We went to the gynecologist, and of course, I'm 16, I'm terrified. And they said, you have a normal period, everything's fine. We're gonna put you on Yasmin, and it'll help your symptoms decrease. And so I thought that, I believed that. A doctor telling me this, it has to be true. And then it became pretty evident that it wasn't true.
We do see young teens with endo. So is that crazy, or does it make sense? Well, if you think about it, it's an estrogen-dependent disease. When does estrogen start in a woman's body? As she starts to develop breasts. That's when the symptoms may start. So it may start even before she has her first period. The pain is different sometimes in adolescent women versus adult women. And that can be tricky for primary care providers, for gynecologists, nurse practitioners, in that they may have been trained to look for endometriosis with pain with periods. But for an adolescent woman, she may have pain in between her periods, pain with her periods, or pain every day of the week. I usually suggest that women think about, can they do their best? Or are they disadvantaged by their symptoms? If they're disadvantaged, that's not normal. They shouldn't be missing school. They shouldn't be in pain to the point where they're cranky or don't want to participate socially in what's going on in their lives. That's when we need to listen to them and move forward.
When you're just starting out and you're going through teenageness, which is a very difficult time, your hormones are going up and down. You're trying to define who you are as a person. If you're looking at your peers very carefully, they're looking at you very carefully. You don't want to stand out in a negative way. And yet here you have this pain, this thing that's stopping you. You're feeling older than your young years.
I think it's hard to have a chronic disease, no matter how old you are. But if you're a teenager and you have a chronic disease that involves your female reproductive tract, and most kids your age, if you're a 12 or 13-year-old, feel uncomfortable talking about reproductive issues, makes it a difficult situation.
What I try to tell parents of teenagers is the most important thing you can do is be there emotionally for your daughter. Meanwhile, start reading everything and, question. Sit in front of the computer and look at some of the things online and question with her.
When I went to school in the 80s, I was taught that endometriosis was a career woman's disease. What does that mean? It meant white women who had insurance, you listen to their pain. It's pretty sad.
The idea that it was career women's disease, that stereotype was constructed around a profile of a white professional, highly educated, probably high-strung woman who has not had children. Right, so already you can see what kind of stereotype that is. And the argument was that's what this disease is about. And the implication of that is the best treatment is to immediately have a child, right? Whether or not that works for you, or a hysterectomy, neither one of which proves to be a good solution.
Pregnancy is not a cure for endometriosis. It's another myth. And yeah, some women, their symptoms get better afterwards, but some women don't. And I think it's really inappropriate for doctors to be recommending that as treatment. And I know a lot of women with endo are told that even when they're single, even when they're young. Bringing a child into this world is not a medical treatment. It's a really important decision for a woman and a couple to make.
I do see 15, 16, 17-year-olds who come from other healthcare providers who are frustrated, and the families are frustrated, and they're told they need a hysterectomy. I think that's criminal. I do not think we should be removing the reproductive tract of young women, or any woman, until she herself has decided she has completed childbearing.
If there's estrogen and the peritoneum with the disease is left, hysterectomy will not help. Removing the ovaries will not help if you leave the disease behind.
There may be up to 20% of those women that have recurrent endometriosis even after they've had their uterus and ovaries removed. And specifically, those women who are treated with estrogen after they've had their hysterectomy may have recurrent endometriosis, perhaps as high as 40% who are treated with estrogen.